We know that having MS can make exercising challenging. You may have symptoms like weakness, sensory disturbance, or overwhelming fatigue. Movement can be effortful, and this may mean that you may move less. Less movement can lead to further deconditioning if you're not careful, as moving less can mean our muscles get weaker, we can feel stiffer, more fatigued, and generally less fit. This can unfortunately make things worse. The really good news is that this non-use weakness and deconditioning is reversible through exercise and activity. We all know that exercise is important for our health and well-being. It can help control our weight, reduce our risk of heart diseases, reduce our risk of diabetes, improve our mental health and mood, help keep our thinking, learning and judgment skills sharp as we age, strengthen our bones and muscles, reduce our risk of falls, improve our sleep and improve our sexual health. We know that these health benefits are just as true for people with MS. Specifically, exercise has been shown to have positive effects on cardio fitness, mobility and balance, muscle strength, mood and depression, fatigue and memory, and thinking skills. There are also additional benefits to keeping active and exercising for people with MS. Exercise can help reduce relapse rate by 27% in those who participate in regular exercise. We are also starting to understand that regular exercise can slow progression in MS by reducing inflammation in the central nervous system and reduce brain volume loss. Having other health conditions such as obesity, high blood pressure, heart disease and diabetes can make your MS worse. Exercise and activity can help manage and prevent these conditions, so it's even more important for people with MS to try and be active and exercise. MS symptoms can make exercising difficult, and until recently, there have been misconceptions about the safety of exercising with MS. Historically, people with MS were advised to avoid exercise, as it could make symptoms temporarily worse. We now understand that this is due to heat sensitivity. Exercise can raise your body temperature, and this increase affects how your nerve impulses travel. They can travel slower or become disrupted with heat, especially where your myelin, the insulating layer around your nerves, is thin or damaged. This can mean symptoms such as weakness, sensory or visual disturbance can temporarily become worse. What is important to know is that once you cool back down, your symptoms return to your baseline, and you have still gained all the benefits for having done the exercise or activity. Also, you do not cause any damage to your nerves or further disease activity. Therefore, it is important to try and manage your temperature when you're exercising. Ways in which you can keep cool when exercising are wearing loose, cool clothing you can take off in layers as you warm up, exercising in well-ventilated or air-conditioned environments, have cool drinks to hand. Some people also find cooling garments you can purchase useful. Considering how you exercise is also important. You may need to pace yourself to keep cool. For example, if you're in a gym environment, you may want to avoid doing the cardio machines one after the other. Separate them with gentler exercises or stretches. We also know that completing cardiovascular exercises in 2 to 3 separate 10-minute sessions is as beneficial as completing 20 to 30 minutes in all one go. So pacing and rest can be used to keep cool. There have been misconceptions in the past that exercise can cause relapses. We know that this is not true. It is safe to exercise with MS. Starting exercise is daunting for us all. The best place to start can be reducing the amount of time and frequency you spend in static postures, for example, sitting during the day. Try and move your body every hour by moving in the chair, getting up, walking around or doing some household chores. Then you can start adding additional activities within your routine, possibly walking rather than driving, or walking to the next bus stop, gardening, swimming, home exercise or dancing. Think about what activities you enjoy, as this will make you more motivated to do them more often. Basically, within your routine, try to move more and sit less. The next video will explore the types of exercise that can be done and how to introduce it into your routine.